Hi, Chris Geller here again with Pinnacle Training Consulting System. So we're going through some more assessments of the spine, particularly of the lumbopelvic girdle. And when I said the lumbopelvic girdle, I'm talking, remember, about the lower pelvic region and to the lower tailbone above the SI, that lower lumbar region. So one of the tests that I found in a lot of the research when I was down in Australia that works really nice, it's simple to use with your clients. Maybe you're pressed for time. You don't have a lot of equipment, and it's real easy. It's called the sitting hip flexion test. And all you're going to do basically is ask the client to put their hands on their chest. You're sitting on a table, and you actually elevate it. So right now I'm on the ground, so it's too easy for me, but you're actually off the ground, and you're going to ask them to flex their hip, and then bring it down, and then do the other hip. Now, what normally should happen is they should just have a normal raising of their leg and no tilting. If they do this and they tilt to the side or lean, that's indicative of what? Possible weakness of the muscle, and also be indicative of tightness of the QL. So if they're going like this and they lean to the side, you can see how this is going to be shortened and this will be elongated as they flex their hip. Again, not a foolproof test, but it's something that's quick and easy to use. That's called the sitting hip flexion test. So normal should be straight up like this. Abnormal is tilting to the side, which you can see in your manual. The second test that I like to use, and there's a lot of research behind Paul Hodges. Paul Hodges is a physio out of Australia who has 3 doctorates, who is extremely really smart and I respect highly, and it's called the multifidus test. A multifidus test is basically where you are having the client lie, again, on their stomach, typically on a plinth or a table or bench. You're asking them to lie on their stomach and just relax. You're palpating on the transverse processes, not the spinous. In the manual, you can see there are some X's that I put in the manual. Those X's are on right here. And what you're looking for is to see how they contract the muscle. So you're saying, what I want you to do is I want you to lift your leg up. So the leg is here, and they lift the leg up. What normally should occur is they should contract the muscle first, then the glute, and then the hamstring. Abnormally, what you can see in the manual, is they'll fire the glute or hamstring first, and then the lower back. So that's called abnormal movement pattern. So I'll repeat that. You want to see firing, and the firing is, again, you're using your fingers to feel. So when you say, and I'll bring my colleague in a minute, I want you to extend your leg up, and they extend up, and they're not firing here, that means they're using their glute max and their hamstrings more than their multifidus, which means they're not dynamically using, well, statically first, the multifidus, which remember is that stabilizing muscle, which is important to control through here, okay? All right? So I'm going to ask my colleague, Laura, to come in and lie down on her back for me, please, or on her stomach, please. So again, you've already talked to them, consent. This is something, again, we've got about ethical legal. I've already talked to Laura for my consent. She has consent. She's giving me consent. And all you're going to do is pull up the shirt just a smidgen. You don't need to expose a lot of lower back. Remember, the center is the spinous process. On the side is going to be the transverse. So I'm right here on the side of the transverse process. And again, what I want Laura to do first, without me coaching, is I want you to raise up your leg first towards the ceiling and lower it down, okay? Then you take your fingers on the opposite side, which is on the left. Same thing, Laura, please raise your left leg to the ceiling. Okay. Now, what I've seen, if you can see it, she's getting more rotation this left side. And I felt like she was using more her thighs and her hamstrings than the actual multifidus. Here's the trick. Ask your clients to do a slight anterior pelvic tilt. Remember, anterior pelvic tilt means forward. So you're cueing them using your hands. You're physically touching them and giving them that proprioception, which is nice feedback, especially for those who are visual clients and need that reinforcement to, here's posterior, and there's anterior. You can feel the difference? Okay? So I want you to hold it right there. Now, maintain the little contraction. Laura, now what I want to do is, Laura, I want you to bring your left leg up, your right leg up, and lower it down. Beautiful. Okay? Keep that tilt. Now, raise your left leg up, please, and lower it down. And then one more time on the right. Good. And she's fighting with that. So she's now getting more control, or I should say more contraction from the multifidus, which remember goes from the tailbone all the way up to the top of the spine or the skull, and I feel that's working a little bit better. So again, if Laura's my client, I would want her to work a little more on this before we progress to something like quadruped on a ball or planks or something more dynamic. The reason is, if you think about it, you need to creep before you cruise, before you walk, before you run, right? So if you can't get them to contract statically, excuse me, then how can you get dynamically? Remember also those clients you have, they've had a low back injury. Maybe they got short physio. They didn't get enough physical therapy. They need to make sure that these guys are working very comfortably. Thanks again, Warren, I appreciate it. So when we're talking about looking at making sure we contract things the right way, we want to make sure that you have understanding that, we go back to the anatomy for just a brief second. You're palpating on the side of the transverse process, which is right here. The spines are the big wings, and this is the side here, the transverse. You're palpating, giving them feedback. You want them to do an anterior tilt forward. That contracts the multifidus, which engages that muscle to facilitate stability, right? Then, hopefully when they've got it, you're asking them to process that, take that in, understand what they're trying to do, and lift up their leg to control and lower it down. So they're not using their glutes and their hamstrings. They're contracting here first, then the glutes, and then the hamstrings. I hope that makes sense. I hope I've clarified. This is another technique you can use with your clients. In this next section, we're going to talk a little more about the shoulder and how to assess the shoulder.